We are proud to have with us today Dr. Richard Merkin from the Heritage Provider Network to announce for you the Heritage Health Prize. So without further ado, I'm going to have him come on up stage and talk to you about the Heritage Health Prize.
I'm Richard Merkin. I'm the founder of Heritage Provider Network, and I want to thank Data 2.0 for being gracious enough to invite us to kick off the $3 million Heritage Health Prize. We have a $2.2 trillion healthcare system in the United States. Think about and imagine if that was different. In fact, for those that desire, close your eyes and think about what a system that would save that $2.2 trillion would be like. Think of the physicians or your medical doctor who could have 100 patients in their office or 100 patients in their patient population rather than the thousands that they currently do. Think of the doctor who would see 5 or 6 or 7 patients a day rather than the multitude that they do today. Think of the doctor who could go to your home and do home visits. Think of the doctor who would know not only your medical needs, but your psychological needs, your social needs, would know interaction of support systems that people have at home. Then think about it from the patient population. Think of the patient who no longer would have anxiety and rush to the emergency room not knowing what is wrong with them. Think about the patient who would be able to have the cell phone of their doctor and be able to call the doctor and ask the doctor to come to visit them. We don't have that system today, and we, the healthcare industry, cannot do that by themselves, but we could do it with you. We could do it with passionate, innovative, unconventional thinkers, people that are creative, people that will be able to develop predictive modeling models, people that will be able to designate who really needs care, what percentage of the patients today become hospitalized. Well, patient population that would be in this room maybe 4 to 5%. An older population maybe about 15%. If we could predict who needed that care and marshal our resources so that we put a lot of energy and a lot of resources into focusing on those people that need the care and need hospitalization, we might be able to avoid unnecessary hospitalization. It has been reported that there were over $40 billion of avoidable hospitalization in 2006, and it has only gotten higher since. Now, is this an original idea? No. Contests, prizes certainly have not been original. The British government had problems with losing ships and wanted to find a way to measure longitude. In the 1700s, after Galileo was unable to solve that problem, Newton was unable to solve that problem, an obscure clockmaker solved it. A century later, Napoleon's army had problems with malnutrition, and there was a prize put out for food preservation. Another obscure candy maker this time took food, put it in a glass bottle, put a cork in it, boiled it, and that became eventually the canning industry. And then, of course, everyone knows about the Orteig Prize, where Charles Lindbergh first flew transatlantically. So all of these prizes ended up causing world changes, huge changes, new industries, and our expectation is that by changing, by doing predictive modeling and ascertaining in advance who is going to need hospitalization, we think that that will change the world, not just the United States, but globally. Medi-Cal, Medicaid nationally, has $3.9 trillion underfunded costs since the beginning of Medicaid. Medicare has $1.8 trillion underfunded costs. We cannot continue like this. We have to figure out a way where we can improve quality, we can lower costs, we can make healthcare affordable. And the best way to do that, from our perspective, is to identify in advance who are those complex cases, who are those cases that need much more focus than we are able to provide today. So what we expect for an outcome, we expect to save some of that $2 trillion, and that $2 trillion is almost all spent on care. Almost none is spent on cure. If we saved some of that and redirected those costs, which might be avoidable, and redirected that to cure, think about the change that we could have worldwide, globally, in health. Heritage Provider Network has historically, and for over 30 years, been able to coordinate care where there's a captain of the ship, where doctors communicate, where people in real time, doctors, nurses, hospitals in real time know what is happening to the patient. This coordinated care, if we embellish this and we use this in conjunction with predictive modeling, I think we can change the world. And I expect the people in this room and people like you, the innovative, the unconventional thinkers, the people that look at the world and see what exists and doesn't say why, but the people that dream what does not exist today and says, why not? Those are the people that are going to change the world. Relationships, loyalty, friendships are very important to me. And I'm very proud to have as one of my close friends Governor Mike Leavitt, a two-term governor, Secretary of HHS, and no one that is more qualified to talk about the healthcare crises that we have in America today. Governor Leavitt.
Thank you. Thank you, Dr. Merkin. Thank you. I would like to just make 2 points today. The first is that there is a very significant, yes, my microphone is not working. There is a very significant change that's taking place in societies all over the world. And I would suggest it is we're moving from societies that are primarily driven by human compassion to societies that are, to a large extent, going to be driven in the future by global economic dispassion. Let me describe what I mean by this in just telling you a quick story. Year 2000, I began to notice in Argentina that there are some fascinating things happening that are counterintuitive to me. At the time, I was a political figure, and so I watched this, and I saw them in Argentina beginning to roll back a series of constitutionally protected pensions. And at the same time, they were raising taxes to raise more money, but they were doing it in the context of a national election. I thought, these are the most courageous politicians I've ever seen. I went to Argentina, and I had a day with the president of Argentina, President Menem. I asked him, why are you doing this? He said, let me tell you about the history of Argentina. He said, if you go back 200 years ago, you'll see that the #1 economy in the world was France. Roll forward 100 years, you'll see it was the UK. But at that point in time, there were two economies that were battling to become #2. One was Argentina, and the other was the United States. We know what happened to the United States, what happened to Argentina. President Menem said, we made 3 mistakes. The first is we realized that if you just continue to give people pensions, that you could stay in office. And the second is if you made it harder to change, you could stay longer. And we did more and more of it. So by the time they got into the early 1980s, they had 60% of their entire economy or their entire population either on a government pension or working for the government. That's a big problem when 40% are trying to pay for 60. The second mistake, he said, is that we didn't have enough money, so we just started borrowing money to do it. And the third is when people told us to stop, we didn't. And so by the time we got into the early 1990s, the World Economic Community had said to us, either you stop what you're doing or we're not going to loan you any money. That's what I was seeing was not political courage. It was an economic imperative. The world across the planet now has societies that are facing that same dilemma. Whether it's Ireland, the UK, France, Italy, Portugal, or the United States, the entire developed world has essentially created such a burden for themselves that they absolutely have to now turn to hard economics to say, how can we contain the cost of health care? Now, as Dr. Merkin has suggested, the magic formula for containing costs in health care is to keep people out of the hospital unnecessarily. The dilemma is we don't know how to do that. Now, in the past, innovation in health care has been a new gadget, a new device, or a new chemical. In the future, innovation is going to be taking masses of data and being able to apply it to the question of, predictively, when do people expect to go to the hospital and how can we keep them out? Now, Dr. Merkin has stepped up and put forward the Heritage Prize, which is $3 million to those who can crack the code. The new era of health innovation is that the value proposition will be king. Those who can demonstrate where need is required, where there is a need, and how to provide high quality and low cost will in fact be leaders in the future. So here's the bottom line is this. Governments are poor innovators. For quite a while, I ran the largest government healthcare system on the planet. What I learned about it is that it's a lousy innovator, but they're great at being able to take someone else's innovation and move it forward. That's what we're calling on you to do today, is to begin to find the innovation so that government and other payers can move it forward. The Heritage Prize is a very good start at that, and I want to congratulate Dr. Merkin and his colleagues, and I simply want to say, if you want to change the world, win this prize. Thank you.
Hi, I'm Anthony Goldblum from Kaggle, and we'll actually be running the prize, the day-to-day operations. I'll just give you a very brief rundown on how it will work. So today, the reason we're here today is we're launching the prize today. So as of today, the rules are available for all, and we've released a data set, the first pass at the data set to get people started. Now, we're releasing the data in 3 tranches because it's very large and somewhat overwhelming. So today, we release some basic claims data, as well as some outcomes with which people can sort of start building their models and generating predictions. On May the 5th, we will open the competition up for entries. We will also be releasing a bit of extra data, including the test data set on which people are evaluated. Then on June the 4th, sorry, I said May the 5th, I meant May the 4th. Then on June the 4th, we release some ancillary data on prescriptions and lab results. At not quite the 6-month mark, I think it's listed as the end of August, we'll be awarding the first Progress Prize, which is a total of $50,000 to the person leading at that point. At the end of around the first year, on February 13th, a little bit under, the second Progress Prize, which totals $80,000. On September the 4th, the final Progress Prize, this will amount to $100,000, and then in 2013, so the competition runs for 2 years, on the assumption that the performance benchmark is met, the winner will win $3 million. Thank you, and good luck to all those who participate.